something about bone tumor. And the bone tumor is a topic is very important for our exam. So let's start. First of all, we talk about epiphyseal tumor. So I remember like this: OBCC. CB means chondroblastoma, condensed tumor, and OBC OC, osteoclastoma, which is a giant cell tumor. Both are benign tumor, but it is locally aggressive. Then how to differentiate when we go for epiphyseal tumor between in these two? So we just see the age of the patient, which given in the clinical variant. So if the before the 18 years, then that should be chondroblastoma, which is Codman tumor. So we there is 4 features we remember, like PPP and chicken wire calcification. So proximal tibia, proximal end of the humerus, punctate calcification, chicken wire calcification on the bone biopsy. Then most important, which is giant cell tumor, GCT, which aka osteoclastoma. It's more found in a female after the 18 years of the age, and it is a epiphyseal metaphyseal lesion. Most commonly, the most common location for GCT is around the knee, which means a proximal tibia and distal femur. It's also seen in a distal radius. If it's locally advanced, like it's involved the proximal fibula or it's involved the distal ulna, then we have to excision of the that tumor should be done. Otherwise, we just do extended curettage. Clinically, when we percuss or palpate, there is axle cracking we heard. When we took X-ray, there is a subopal appearance, and the biopsy we can see neoplastic giant cell tumor, which is osteoclast like giant cell. And here it's see, and we see this is the image of the biopsy. We are seeing like multiple nucleated cell, which is GCT cell, and here in the distal radius we are see like subbubble appearance is a epiphyseal metaphyseal tumor. We are seeing there's involved a metaphyse as well as diaphyse. Now we do some other one with the GCT, and I named as a GCT variant. First, fibrous dysplasia. Fibrous dysplasia means what's fibrous dysplasia? Dysplasia means abnormal growth, and fibrous means fibrous tissue, means bone tissue are replacing by the fibrous tissue, so that it's bend and give the appearance of the Shepherd-Cook deformity. It's generally 1 to 3rd decade of the life. It's diaphyseal tumor, and it is exist in a 2 form, like monoostotic and polyostotic. Polyostotic has associated with like Macon-Albert syndrome. What is Macon-Albert syndrome? Macon-Albert syndrome, which PPP with 3P, precocious puberty, polyostotic fibrous dysplasia, and pigment. Now if the examiner gives a photo of the pigment, then we have to differentiate it Macon-Albert syndrome from neurofibromatosis 1. How? So both are coffee light spots. Now in the Macon-Albert syndrome, there is a rough border which doesn't cross the midline, and in case of the neurofibromatosis 1, which aka NF1, it is a smooth border which cross the midline. Okay. If the polyostotic dysplasia associated with intramuscular myxoma, that is called Nisebranch syndrome. Now we see the image of the fibrous dysplasia, which is this fibrous dysplasia is also asked in the recent 2023 NEET PG, which I appeared. So we see this Shepherd-Cook deformity here. Okay. And treatment is for the fibrous dysplasia is bisphosphonate. Now we see a difference between the simple bone cyst an aneurysmal bone cyst. Why we are discussing like fibrous dysplasia, simple bone cyst, aneurysmal bone cyst here with GCT? Because the GCT involve in a distal radius, so it's also same kind of the lesion. The simple bone cyst and aneurysmal bone cyst. Simple bone cyst, which is we are seeing, that is simple, both are seen in second decade of the life. The more the beginning of the second decade, like 11 to 15 years, we are see simple bone cyst, and 15 to 20 years we are see aneurysmal bone cyst. The simple bone cyst never involve the cortex, and it's mostly it is asymptomatic, but due to some trauma it's become a symptomatic, and we took the x-ray, we see two classical sign, which is a trapdoor sign and fallen leaf sign. An external and curettage is done, but before it, what we do, simple bone cyst is a just fluid filled cyst in the bone. So what we do, we put the injection, we aspirate that fluid, and we inject the sclerosant one. If it is not work out, then we do excision and curettage. Now aneurysmal bone cyst, it is a multiple eccentric filled with blood. It's involve the proximal tibia, then the femur, and here is treatment also same, extended and curettage, filled cavity with nitrogen liquid, and pelvic examination may be done, because pelvis, if the pelvis is involved, then embolization should be done.